Thrombosis. Thrombosis is the process of formation of a solid mass in circulation from the constituents of flowing blood. This mass is called thrombus. Thrombosis is similar to blood clotting. Blood clotting is where there is conversion of fibrinogen to fibrin fibers, and thrombosis is activation of platelets. Example of thrombosis is a hemostatic plug. The blood clots are formed at the site of bleeding, where there is injury to the blood vessel. These stop the escape of blood and plasma, but when the thrombus is developed in unruptured cardiovascular system, it may be life-threatening, causing ischemia and thromboembolism. Ischemia is where there is decrease or stoppage in blood flow. Thromboembolism is where the thrombus dislodges and is carried along in the bloodstream as an embolus. Pathophysiology of thrombosis, we need to remember the Virchows Triad. The Virchows Triad includes endothelial injury, altered blood flow, and hypercoagulability of blood. Endothelial injury, integrity of the blood vessel wall or the endothelium is essential for maintaining the normal blood flow. In case of vascular injury, it exposes the extracellular matrix which initiates hemostasis and thrombosis. Endothelial injury causes vasoconstriction of the small blood vessels, and it also results in the formation of arterial thrombi and thrombi of the heart, especially seen in the left ventricle of the heart. Causes of endothelial injury includes myocardial infarction, that is MI, cardiac surgery, arterial disease, diabetes mellitus, endogenous chemicals like endotoxins, and exogenous chemicals like cigarette smoking. Alteration of blood flow. Turbulence means unequal blood flow. Stasis means slowing of blood flow. Normally, rapidly moving stream consists of leukocytes and the RBCs, that is the red blood cells. In slow moving, we have the central stream which consists of platelets and the peripheral stream which consists of cell-free plasma. Stasis. When the blood slows down, blood cells, platelets migrates to periphery forming a pavement. This allows higher release of oxygen from the blood. Turbulence injures the endothelium, which further results in deposition of platelets and fibrin. Therefore, stasis initiates venous thrombi and turbulence facilitates arterial and cardiac thrombi. Hypercoagulability or thrombophilia. A few conditions have increased risk to develop venous thrombosis. We have the hereditary and the acquired factors. Under hereditary, we have antithrombin 3 deficiency, protein C and S deficiency, defect in fibrinolysis, increased levels of coagulation factors, that is factor 2 and factor 8. Under acquired, we have shock, heart diseases, obesity, cigarette smoking, tissue damage, etc. Types of thrombi. We have the cardiac thrombi, arterial thrombi, venous thrombi, and the capillary thrombi. Cardiac thrombi. It is commonly seen in the atrial appendages, in the right atrium, mitral, and the aortic valves. Ball valve thrombus is a large round thrombus that obstructs the mitral valve. A gonal thrombi occurs in either or both the ventricles. It is composed of fibrin and forms shortly before death. Arterial thrombi. These are usually formed in the aorta, coronary arteries, mesenteric artery, renal artery, and the cerebral artery. Complications, it results in ischemic necrosis. Venous thrombi. It occurs in the lower limb veins, that is varicose veins, popliteal and femoral and iliac veins, hepatic and portal veins, superior and inferior vena cava, mesenteric veins, renal veins. Complications include skin ulcer and poor wound healing. Capillary thrombi is composed of packed red cells formed in acute inflammatory lesions and vasculitis. Complications includes DIC, that is disseminated intravascular coagulation. Fate of thrombus. You can remember the word rope, R for resolution, O for organization, P for propagation, E for embolism, which is thromboembolism. Resolution. The thrombus activates the fibrinolytic system. There is release of plasmin which dissolves the thrombus, resulting in resolution. The large thrombi do not dissolve. Small thrombi undergo lysis. Fibrinolytic activity may be accentuated by administration of thrombolytic substances, for example urokinase, streptokinase, in the early stage, when the fibrin is in the monomeric form. Example, acute stage of myocardial infarction. Then we have organization. If the thrombus is not removed, it starts getting organized. Phagocytic cells, which are the neutrophils and the macrophages, phagocytose the fibrin and cell debris. The proteolytic enzymes start digesting the coagulum. Capillaries grow into the thrombus from the site of its attachment, and fibroblasts invade the thrombus. Fibrovascular granulation tissue is formed. Thrombus is excluded from the lumen into the vessel wall. New vascular channels may re-establish the blood flow. This is called as recanalization. The thrombus undergoes hyalinization and calcification. Then we have propagation. The thrombus enlarges in size due to more and more deposition of constituents from the blood. Therefore, causes obstruction of blood vessel. Then we have thromboembolism. The thrombi in the early stage is friable and gets detached easily from the blood vessel. These are released in part or completely in the bloodstream as emboli, which produces ill effects at the site of their lodgement.